Assalamu alaikum everyone. Today I will be talking about obstetric and gynecological surgeries. My name is Zainiologist and through this lecture I aim to provide you with a comprehensive understanding of the surgical approaches used in managing both gynecological conditions and obstetric complications. We will go step by step, starting from minor diagnostic procedures and gradually moving towards complex and advanced surgeries. So let's begin the journey. Gynecological surgeries is essential concerned with the surgical management of disorders affecting the female genitalia tract, which includes uterus, tubes, ovaries, cervix, vagina, and uvula. Meanwhile, obstetric surgeries specifically deals with the surgical procedures performed during the pregnancy and childbirth, with the primary aim of safeguarding both maternal and the fetal life. The overall goals of these surgeries are very clear. Firstly, they help in diagnosing and treating the disease. Secondly, they restore and improve the fertility and sexual health of female. Thirdly, they ensure safe childbirth by preventing maternal and neonatal complications. And then finally, they improve the overall quality of life for women by addressing both functional and structural problems. So that was the introduction. Where we begin with the diagnostic and minor procedures. These are usually less invasive but extremely important in guiding treatment decisions. These are the gynecological surgeries, and first we will get through the diagnostic and minor procedures. For example, dilation and curettage and DSC is often performed in cases of abnormal uterine bleeding or incomplete abortions where retained tissues must be cleared from the uterine cavity. For this purpose, lithotomy position is preferred. For endometrial biopsy is another important procedure. It allows us to obtain a small tissue sample from the lining of the uterus, which can then be examined microscopically to detect the precancerous changes or carcinomas. So biopsy is taken to detect the hyperplasia and carcinomas. Similarly, colposcopy and cervical biopsy are commonly performed when there is a suspicion of cervical cancers or intraepithelial neoplasia. Often after abnormal pap smear results, when we get pap smear results that are not normal, then we will taken colposcopy and cervical biopsy to detect the cervical dysplasia. In more advanced cases, colonization of the cervix may be done. Colonization of the cervix, where excision of the cone-shaped portion for detecting and treatment of the cervical dysplasia is performed. A cone-shaped portion of the cervical tissue is excised for both diagnostic and treatment purposes. Other minimal invasive procedures including the hysteroscopy, where we use a small scope to visualize the uterine cavity, detect and directly, and laparoscopy, where serves both diagnostic and therapeutic purposes, especially in conditions like endometriosis, infertility, or ovarian cyst. These procedures reduce the needs for major surgeries and allow quicker recovery. That was diagnostic and minor procedures. Now let's move on to the major gynecological surgeries. The most well-known procedure is the hysterectomy, which is the surgical removal of the uterus. Depending on the indications, this can be total, subtotal, or radical. And the routes to approach the hysterectomy and to approach the uterus is the abdominal, vaginal, laparoscopic, and robotic. The routes of the surgery can also be varied. It can be performed either according to patient easiness and according to the surgeon approach. For women who still desire fertility, a mammectomy is performed just to remove the fibroid and preserve the fertility. In case of the abnormal uterine bleeding, we may perform the endometrial ablations or dissections to secure the bleeding. Abnormal uterine bleeding, which may be results of any other trauma, or there is any cut, or there is a scarring occurs, then the endometrial ablation and dissection is performed. When we shift to the ovarian surgeries, the most common is the ovarian cystectomy, in which we excise the benign cyst, just to remove the cyst and preserve the fertility. For oophorectomy, we remove the ovaries. This is surgery is performed in advanced cases of the cyst, and if there is a tumor and if there is a malignancy, then we will remove the ovary. This procedure is called oophorectomy. In ovarian drilling, which is a laparoscopic procedure, may be performed in patients with polycystic ovarian syndromes to restore the ovulation. Here is the incidence of the hysterectomy. Vaginal hysterectomy is preferred more as compared to total abdominal hysterectomy, and total abdominal hysterectomy is performed and is preferred over the laparoscopic. Then myomectomy is preferred lastly. Then tubal and oncological surgeries. In fallopian tube, surgeries are performed in various situations. A salpingectomy is performed, in which we have to remove the fallopian tube, commonly indicated in a case of ectopic pregnancy or hydrosalpinx. In hydrosalpinx and ectopic pregnancy, the whole tube is removed, which procedure is called salpingectomy. I will give detailed lecture regarding this in next lectures. Keep watching on my channel. You have to keep watching on my channel for more informations. Alternatively, a salpingostomy may be performed when we aim to conserve the tube in cases of ectopic pregnancy. When we want to reserve the tube and just to remove the ectopic pregnancy, we perform the procedure which is known as a salpingostomy. We conserve the tube, we conserve the fertility, and we maintain the fertility. Alternatively, this procedure is performed over the salpingectomy. For patient with blocked or damaged tube, tuboplasty is performed in an option to restore patency and improve the fertility. Additionally, the tubal ligation is also performed, carried out as a permanent sterilization procedures. When it comes to, let's move on the oncological surgeries. The radical hysterectomy for cervical cancer has to be performed. In ovarian cancers, debulking surgeries are performed is the cornerstone, aiming to remove as much of the tumor mass as possible. Lymphadenectomy is performed, removal of the pelvic or para-aortic lymph nodes, help in staging and management. In very advanced and severe cases, a pelvic excision or palliative surgeries are performed. As much of the cancerous material is removed to secure the life, not to ensure the organ's functionality, just to ensure the patient life or survival. Then there are also reconstructive surgeries. I just skipped over there, but reconstructive surgeries to reconstruct the organs. Then there are obstetric surgeries. Obstetric surgeries, the most frequent performed obstetric surgery is the cesarean section. This surgery may be indicated for maternal reasons such as cephalopelvic disproportions, obstetric labors, history of a previous C-sections, placenta previa or placenta abruptions. It may also be performed for fetal reasons, including the distress, malpresentations such as a breech or transverse lie or multiple gastrations have done. So cesarean section is preferred. But now this is becoming a trend over normal deliveries. Females just prefer the cesarean section. They prefer over the normal deliveries. There are two main types: the lower segment cesarean section, which is most preferred method, and the classical C-section, which involves a vertical incision and is rarely used. It is just like a laparotomy. Of course, like any other surgery, it carries risk. This including the hemorrhage, infection, adherence, and anesthetic complication. Despite this risk, it is often a life-saving procedure for both mother and baby. Then there is a operative vaginal deliveries and cervical procedures. In some cases, vaginal deliveries can be assisted surgically. For example, episiotomy is one such intervention where an incision is made in the perineum to facilitate delivery. It can be mediolateral or midline. This is just a small procedure, just to aim the normal delivery. Forceps delivery is performed in situation like a prolonged second stage of labor or when the fetus is distressed. Alternatively, a vacuum extraction or ventrous delivery may be done. This is associated with less maternal trauma but carries some risk of the neonatal scalp injuries. Another important obstetric intervention is a cervical cerclage. This involves placing a stitch around the cervix to prevent it from the dilating prematurely, which can lead to the premature labors. Techniques like a McDonald's or shortcut methods are used. I will discuss them further in the next lectures. And the procedure is particularly beneficial for women with a history of recurrent second trimester losses or preterm labors due to cervical incompetence. Let's move forward to the ectopic pregnancy and other obstetric procedures. Ectopic pregnancy is a serious condition that requires the surgical management in many cases. So basically, what is the ectopic pregnancy? The fertilized ovum or the fertilization occurs other than the uterus in any of the part of the genitalic tracts, like in a fallopian tubes, in ovaries. This is called ectopic pregnancy, and this has to be removed. This can be removed by the conservative method, can be removed, or can be removed. Whole tube can be removed. If the tube can be preserved, a salpingostomy may be performed, as I already discussed it, where the ectopic tissue is removed but the tube is left intact. However, if damage is severe, a salpingectomy, removal of the entire tube, may be necessary. Nowadays, laparoscopic approaches are generally preferred due to faster recovery and less morbidity. Other common obstetric procedures including the manual removal of the placenta when it fails to deliver spontaneously, evacuation of retained product to prevent hemorrhage or infections, and the surgical repair of perineal tears sustained during the childbirth. So recent advances, in these slides I have just sum up the difference between the gynecological surgeries over the obstetric surgeries. So the gynecological surgeries have main focus on diseases of female genitalic tract. Meanwhile, the obstetric surgery is performed for pregnancy, labor, puerperium, and these procedures are performed for life ensure or life safety of the female and the fetus. For example, hysterectomy, myomectomy, prolapse repair, oncological surgeries are all the gynecological surgeries. Meanwhile, the obstetric surgeries including the cesarean section, cerclage, ectopic pregnancy, and PPH. The nature of gynecological surgery is mostly elective, but the obstetric surgery nature is the emergency and urgency. Goals of the gynecological surgery is to restore the reproductive health, and the goals of the obstetric surgery is to save delivery of fetus and maternal safety. Finally, let us look at some of the recent advances in the field. Laparoscopy and robotic surgeries have become the increasingly common, providing minimally invasive options that reduce the hospital stay and accelerate the recovery. Fertility sparing surgeries are another remarkable development. For example, instead of removing the uterus in every case, procedures like a myomectomy or conservative management of ectopic pregnancy are preferred to preserve a woman's reproductive potentials. In obstetric interventions and improve the aesthetic techniques have made cesarean sections and other procedures much safer to both the mother and the newborn. These advances highlight the way surgical practice and continues to evolve, always aiming to enhance safety, reduce the complications, and preserve the functions. To conclude, obstetric and gynecological surgeries play a vital role in women's healthcare. These range from minor diagnostic interventions to life-saving and reconstructive surgical procedures. With continued advancement in surgical technology and techniques, outcomes are improving and patients are experiencing these safer, faster recoveries. Thank you so much for your attention. Keep watching on my channel. Subscribe to my channel for more information. I will deliver more lectures regarding this. Thank you so much for your time. Allah Hafiz.